talking to the president about 2 days ago, and he said, well, yeah, you look very distinguished with your beer, but my sons have those, and I don't really approve of those, and I'm not sure what I think of that beer. And I said, all right, Mr. President. But no, it really wasn't rough on me. I was very lucky in the sense that I never really got sick. I never had a fever, never had a body ache, never had a cough. And so I'm one of these ones who are asymptomatic. And this is some of the biggest news that's come out in the last week, is that when you test the general population for antibodies, we're finding that many more people have this than we suspected. And the good news about that is that when you divide it out for mortality, turns out that the mortality is going to be much less than has been reported. And this is good news, I think, about trying to reopen the economy. I know the president's been pushing and saying we have to reopen. I'm exactly the same way. There's no amount of money in China, no amount of money we can print up to save our economy if we don't reopen.
Yeah, that's exactly right. And the president makes the point that the American economy was never built to lie dormant for 3, 6, or 9 months at a time. And we certainly have to get the economy going again as soon as it is safe to do so in various parts around the country, probably sooner than other parts of the country.
But look at it this way. For example, all that money that was given to small business was gone in 3 days. Another $400 billion has been allocated, and people are saying it's mostly gone. There's an endless consumption of money. If you give money to people, we have to get back to work. And so I think we're right to open. And the other thing I keep saying to people is one size doesn't fit all. New York City's had a calamity, and I don't discount that, and I wouldn't tell them what to do. But I live in rural Kentucky, and there are a lot of rural states that haven't had it as bad, and we're ready to get working again.
Yeah, that's exactly right. And so the president and the Senate, folks such as yourself, are really on two tracks. One is to protect the health and safety of Americans, of course, but also to safeguard the economy. Let's talk about the healthcare angle, which is certainly something that you have been focused on for your entire adult life as an accomplished eye surgeon. And the president's opponent in this race, the apparent opponent, is Joe Biden. And he's running on trying to expand Obamacare, which, as we know, had many facets of it that were disastrous in the first place. What are your thoughts on Obamacare generally, and why was it such a wrong direction for the country to take?
When I ran for office back in 2010, it was the number one issue and was for 4 or 5 years, Obamacare. We objected to it for two reasons, and this is sort of where the Tea Party started, but for two big reasons. One, the freedom issue, the idea of whether you should be free to choose what kind of insurance you have, whether you have insurance, and to choose your doctors. Obamacare takes away that choice. And so freedom of choice to me is always the number one reason why I don't want someone in government telling me what to do about my health care. But the number two item is equally strong and even stronger for people who don't accept the freedom argument. That's the practical argument that just doesn't work, frankly. All you have to do is look at it this way. What do we know of in government that works better than the private marketplace? In fact, it's always the opposite. It's like if you love the post office, you're going to love nationalized health care. If we look at nationalized health care in England or Canada, people wait in lines forever and ever and ever. So we have a great health system, and I think we'd be fools to lose it. Now, there are problems. There were problems even before Obamacare, but one of the things I worked with President Trump on, and this is really, I think, the genius of President Trump, or one of his main attributes. Everybody else poo-pooed it. In fact, even the mid-level people in the administration were, oh, we can't do that, we can't do that. But I propose that we let small businesses join together to have association plans. This means instead of buying insurance by yourself, you would group together with people, and ideally you'd group together with maybe 1 million people, and you'd have one purchasing agent, sort of like a co-op, and you'd be able to bid your prices down. Well, the president liked the idea. He kept telling all these people, make it so, because they kept nitpicking and saying, oh, we can't do this. It's never been done before. And this is where the president's good, because he acts like a CEO. He says, no, it's a good idea. I want it done. And we finally got it done in record time, and the Department of Labor signed it into being. And so now it is legal for many different sole proprietors, individual business owners, to join together. The Chamber of Commerce has facilitated this in many states, sometimes the Farm Bureau, sometimes different entities like that. But that way you don't have to buy insurance by yourself. But it also shows that we truly care about those who don't have insurance, but we also care about the cost. The Democrats just want to give it to you and say it's free and say, here's some money we printed up at the Federal Reserve. go buy yourself some insurance. And the price of insurance skyrocketed and the price to the taxpayer skyrocketed. Through our plan, there's no taxpayer money. We just say you can organize collectively to try to bring prices down. And lo and behold, it's really working. We have some in Kentucky, there's some in Nevada, and it's spreading across the U.S. The Democrats, Biden and others, they've now sued in court to try to stop us. So they're basically suing to try to stop you from having the freedom to go to a big group like Sam's Club or Costco and buy your insurance. So there's a lot of things that we can. And the one mistake I think we've made as Republicans is giving in and giving the moral high ground to Democrats and saying, oh, they care more and all this stuff, about Obamacare and all the different conditions, when in reality, we have real practical solutions for lowering the price and getting insurance to people who've never had insurance before.
Yeah, and so what you're talking about there with the people being able to group together is economy of scale, really, and greater freedom. And inexplicably, Joe Biden is now saying that one of the first things he would do would be to restore the individual mandate of Obamacare, which, of course, as we know, is a tax on people. And Joe Biden is actually proud of that. So let's that insurance that people get through their employers. What's your take on the public option?
Well, it's like most other, lies that we hear. If you like your plan, you can keep it was the original promise. But now this promise is if you like your plan, you can keep it, or you can get the government plan. It's really not going to cost anything. I promise you it won't cost anything. Right. Well, it's just not true. These things turn out to be very expensive. So we have to put them in context. Right now, Medicare, as we know it for senior citizens, is $35 trillion in the hole. Doctors and hospitals know this because every year we're forcing the prices that we pay doctors and nurses and hospitals is going down because there's not enough money. $35 trillion in the hole with what we have. And if you ask a hospital, do you make money off of Medicaid or Medicare? They'll tell you, well, we kind of break even, but if we don't have private insurance, we'd all lose money. And so really what happens is the rural hospitals are loaded up with Medicaid. They lose on every patient. Then they have Medicare. But if they lose private insurance, they won't make any money at all and they will go bankrupt. And to tell you the truth, this is one of the things that worries me most about this coronavirus sort of panic and pandemic is that because we've forbidden elective surgery in our hospitals, which I think was a bad idea, our local rural hospitals, which were already in bad shape, are in worse shape. But if we give them more government pay, it makes it worse. The hospitals will go under. So we have to get the hospitals back started doing surgery and open for business again from the coronavirus. But we also would be foolish to put more government paying or really essentially underpaying patients in the hospital.
Right. And so really the public option is a threat to rural hospitals all across the country and obviously just a bad idea on its face. But fortunately for Americans, President Trump has a wholly different approach, comes at it from an exact opposite angle. And his approach is all about quality of care, choice, and affordability. So let's hear from the President of the United States. There you have the President of the United States, Senator, and I know you were likely in the chamber there that night. And there's a lot to like about the President's approach as compared to the Democrats and Joe Biden. You already mentioned allowing people to group together to get economy of scale. We talked about the individual mandate that the president got rid of out of Obamacare. There's a lot of things. The FDA getting drugs to market faster, right to try legislation, giving patients some reason to hope for medicine that they have the right to try. Give me your broad thoughts on the way that the president and Republicans have approached healthcare.
The only thing that keeps prices down or will get prices to go down anywhere in any marketplace, not just healthcare, and healthcare is not unique, is competition. You have to have choices and people have to see what the price of it is, but then they have to base their decisions on the price. In healthcare, the problem we've always had is we have all these intermediaries. They're either the government making the decision or the insurance companies, and very few individuals actually go in and say, I want this because of the price. And so what we really need to do is have price enter into the healthcare equation. One way of doing it, and this is something that most of us have supported, including the president, is expanding health savings accounts. So that way you can save money tax-free. Then you could buy higher deductible policies, but have tax-free savings to cover the deductible. But then your prices go down, your premiums go down. If we did that, and we could get a significant amount of the public that had expanded health savings accounts, Then we'll get each consumer making choices, and that forces prices down, not only for health insurance, but also for drugs as well, for prescription drugs. So there's a lot of things that go along with our Republican philosophy of more freedom of choice, more competition that can bring prices down. Transparency will work, but I want to caution that transparency only works if you have choices. So if we put up all the prices, but nobody has a choice, it won't work. It's only going to work if we have choices. So it's very important that we not go to a government, public option or something where there's only the governmental choice, because governments really aren't very good at it. In fact, government can be just another monopoly, and then they have to raise prices or incur debt. And the history of most government programs is they go on and on, they're underfunded, and then they beg for more money, or the prices have to go up. The classic example is a post office. They have a monopoly, and yet they can't make money. I know the president's been frustrated recently with the post office, but they can't make any money. We keep subsidizing them, and they can't make any money, even though they're a monopoly. So government is inherently inefficient, and what we need to do is we need to promote freedom for all, that the community will continue to help those who can't help themselves, but we really need freedom of choice and competition. And really, it's the essence of capitalism that we need, but we need it in healthcare also.
Yeah, cautionary words for a complete government takeover of healthcare, which is exactly what Joe Biden and the Democrats have in mind. Senator, before we go, in the time we have left, I want to give you a chance to talk about some things that you do that many people may not know about. You still, in your home Commonwealth of Kentucky, and not just in Kentucky, but around the world, are still providing eye surgery free of charge to people who need that sort of treatment. Tell us a little bit about your good works there.
Well, the first time I actually met President Trump was when I went to Florida to ask him to help one of our mission trips that we took. We did a mission trip to Guatemala, the first one I did back in 2013. The president supported that financially out of his own personal pocket. And we went to Guatemala. We did about 200 cataract surgeries, maybe 220 in about a week. I've gone with the University of Utah and a team of surgeons. We also help to train the local surgeons. So it's not just the 220 cases we do over there, most of whom are blind before the surgery and can see again. We also help to train the surgeon that's there locally so he can or she can continue on with doing these surgeries. We've also gone to Haiti. The president supported that trip financially as well. And then we also do some things just around Kentucky. Even with more government involvement in healthcare, there still, frankly, are some people who can't travel the distance to go to a VA sometimes, or who don't have any insurance, and we still take care of them. We have about 4 or 5 spots around Kentucky where we do surgery. But to tell you the truth, there's a huge difference, and people need to get this in their mind. There's a huge difference between giving something and then having the government do it. People mistake that the government doing it is charity, and I'm not saying we won't have some government safety net, but there's a big difference to each individual who gives something back, because charity, voluntarily giving something, is important. And I think it's one thing we as a party don't emphasize enough, that we as Republicans are a very generous people. Americans are, but particularly Republicans are very generous in giving their time and wealth. And so many good things happen in our country. Salvation Army, you name it, Hotel Inc., all of these different charities, they're funded by capitalism and by the generosity of the American people. And that needs to be a big part of who we are. And we need to make sure that we don't sort of shuffle that aside and not really tell people and let people know that this is what a good community does, and it's what we believe in as Republicans.
Well, Senator Paul, thank you very much for being with us today, and thank you for all that you do for the people of the United States, the people of Kentucky, of course, and as we were just talking about, people around the world. We really, really very much appreciate it, and thank you for joining us today.
Thank you.
We will make America great again.